and leaves behind a wife and daughter. In November, he went to the hospital and was assessed as part of the new scheme. He was treated but not admitted. He died 2 days later. Well, our health correspondent Matthew Hill told me what happened.
Well, we know David Birtwistle went to see his GP on the 10th of November, and then 3 days later on the Sunday afternoon he was feeling breathless, so he went to this new front door service. Now this is a service essentially set up you're seen by a health professional who decides whether you need to see a GP there or to go on to accident and emergency. And in his case he was treated, he was then discharged. Sadly he died 2 days later. We've just this evening had a statement from his wife, Trina, who says David's death was a complete shock as he'd been fit and well, had no long-term medical complications or conditions. The cause of death is still being investigated, and we do not know if the system at A&E that day contributed to his death. Dave was an amazing man, loved by all his family and friends, and his sudden death at such a young age has hit us very hard.
Now, would the patient have died anyway had they been admitted to A&E?
Well, that is something which will be looked at by what's called a root cause analysis. So it's an internal investigation set up by the clinical commissioning group. They're trying to find an expert from outside to give an independent overview on that. But they obviously are taking it very seriously to set up such an inquiry. We've had a statement from Brisdock, the private company, who say our sincere condolences are with his family and there's going to be a thorough investigation.
Why was the scheme introduced then?
It was because of the rise in demand on A&E, a 5% rise there in the last year or so, and that meant that they really want to prioritise the sickest patients to make sure they get seen by the emergency medicine department, and patients who don't really need to be seen there. About a third of patients don't need to go there, are seen by GPs and treated that way.